Good afternoon, friends. I am Dr. Laxman Jessani, consultant infectious disease specialist at Apollo Hospital, Navi, Mumbai, and I deal with different kind of infections. The topic that we are going to discuss today is about long COVID syndrome. So, friends, what is this long COVID syndrome? There are various terminologies for this long COVID syndrome. It's also called as long haulers. It's also called as chronic COVID syndrome. It's also called as post-COVID, post-acute COVID sequelae syndrome. So basically, in general man terms, it's called as long COVID syndrome. So this syndrome is basically a set of symptoms which occurs after the COVID infection has been recovered. So after the acute onset of COVID infection, which is caused by coronavirus, COVID-19 infection, the persons who have been recovered from this illness go on to have certain set of symptoms which persist for a long time. And that is why it is called as long COVID syndrome. So what are these symptoms? So these symptoms can be of various categories. It can be cardiac related symptoms. It can be like symptoms like chest pain, breathlessness on exertion after doing certain work. It is mainly related to the myocarditis, that is the inflammation of the heart which occurs after the COVID infection has been settled, but the inflammation still persists. So because of the myocarditis, there can be left heart failure, and because of it, the patients can complain of chest pain, breathlessness, and so on and so forth. The other category of symptoms are those symptoms which are related to the lungs. For example, the patient may complain of pleuritic type of chest pain. That is a chest pain which occurs especially during taking deep breaths. Then there can be dyspnea on exertion. That is a patient walking after some time may develop severe breathlessness. Now these are all because of the complications of the COVID virus which affects the lungs. It causes damage to the lungs, it causes fibrosis to the lungs, and these long-term sequelae damage to the lungs persist, and that is why the patient manifests with these particular symptoms. Long COVID symptom can also be neurological. So many patients may complain of fade, brain fade, what we typically call as. The patient may not be aware of his surroundings, may typically feel restless, may feel confused, may feel having dizziness, may feel that patient is having no sense of self-being. So these are the symptoms which are neurological symptoms. It can also have peripheral neuropathy and also a symptom called as Guillain-Barré syndrome, wherein there will be loss of sensation of the legs and the limbs. So these are all the neurological complications. In addition to this, there can be some psychological complications. For example, difficulty in cognition, in thinking, mental disorders, depression is very common after post-COVID, anxiety after post-COVID, and we also see a lot of PTSD, that is post-traumatic stress disorder after these COVID symptoms have been occurred. So these are some of the mental symptoms also which we see in the long COVID syndrome. Then there are the symptoms which affect the kidneys. For example, the creatinine, the level goes up. Patient may have difficulty in passing urine because the kidneys are also affected in long COVID syndrome. And of course, their COVID also affects the blood system. So that what happens is that there are a lot of clot formation in the blood. There are small clots which occurs in the vessels, due to which the patient may have problems in difficulty in breathing, may have difficulty in walking, and other symptoms. It can be related to be catastrophic if the clots are there at vital organs like heart or the lungs. So friends, these are some of the symptoms which we saw due to the long COVID syndrome, which affect the hearts, the lungs, the brain, the psychological issues, the neurological issues, and of course the kidneys, and of course your blood system. So what is the treatment for it? So treatment for it is basically prevention. So preventing COVID is the best way to avoid these symptoms, because if you don't get COVID, you won't get long COVID syndrome. But if at all you happen to get this long COVID syndrome, then basically a lot of treatment involves basically rehabilitation, physical exercise, proper diet, taking proper medicines, going to a proper counselor, and of course a proper rehabilitative treatment is the most necessary for the treatment of long COVID syndrome. Best way is to prevent it, as I said earlier, but if you get affected, make sure you visit a doctor with a multicentric team approach like our team at Apollo, where we take into account the entire holistic approach towards the patient, and we specific focus on this long COVID syndrome, which we are seeing now after the COVID epidemic is almost over. Thank you very much. I'll be happy to answer any questions.